Hello, everybody. Today we'll discuss diseases of bones, focusing on their classification. Before discussing diseases, let's quickly review normal bone structure. Bone is a living tissue made up of cells, blood vessels, and a mineralized matrix that provides strength and support. Bone develops through two processes. Basically, there's two processes of ossification: intramembranous and endochondral ossification. Intramembranous ossification means the bone forms directly from the mesenchymal stem cells, whereas the endochondral ossification, the stem cells first form a cartilaginous scaffold, and on top of that, the bone forms. So it's more of an indirect process. Any disturbances in these pathways can result in developmental bone disorders. Mature bone consists of compact bone on the outside and cancellous or spongy bone inside. Together, they provide both strength and flexibility. Compact bone is organized into osteons, which are the functional units of bone. This arrangement allows bone to withstand mechanical stress more efficiently. Cancellous bone, on the other hand, contains tributary and nerve spaces. It is lighter than compact bone and plays an important role in blood cell production, that is, hematopoiesis. Bone is constantly remodeled through the balanced action of osteoblasts, which builds bone, and osteoclast, which resorb bone. Disease occurs when this balance is disturbed. Clinically, bone diseases can be grouped into developmental, inflammatory, fibrosis, metabolic, and neoplastic disorders. This slide summarizes major categories of bone diseases and provides a roadmap for the disorders we'll discuss next. Osteodystrophies are basically non-neoplastic, non-inflammatory disorders affecting bone development and structure. They include several inherited and metabolic conditions. Some osteodystrophies do result from the defects in the structural protein. Examples include osteogenesis imperfecta, achondroplasia, and Marfan syndrome. Metabolic disorders alter bone chemistry, normal bone chemistry. Common examples would be hyperparathyroidism, hypophosphatemia, rickets, osteopetrosis, related conditions. Then osteoclast activities of normal, where bone remodeling is affected. Conditions such as osteopetrosis and chiasm arises as a result of this imbalance. Certain disorders primarily affect the skull and facial bones, producing characteristic craniofacial abnormalities. The examples are listed here. Many systemic syndromes have prominent skeletal features. Examples include achondroplasia, Down syndrome, and chondrodermal dystocia. Cystic bone defects create localized cavities within the bone. Examples are simple bone cyst and iron small bone cyst. Some bone diseases have certain causes. Examples like Pabst's disease, infantile cortical hyperostosis, and massive osteolysis. And other group would be considered as the condition like fibrous dysplasia, vitamin D resistant rickets, which rarely fit in any of the above categories. So in summary, osteodystrophy can be classified based on the underlying mechanisms, including genetic, metabolic, cellular, and developmental abnormalities. Understanding these categories makes diagnosis and management much easier. Thank you for your attention today. See you next time.